Good afternoon, I'm Paul Cadman. I'm the chairman of Downtown in Business, Birmingham. Welcome to the Den. We have an excellent guest today in the form of Dr. Ben Sinclair. Dr. Ben Sinclair is a private practice GP, also has a number of services to offer within his business. His business is Optimise Health Clinic and he's based in Birmingham. Dr. Ben, can you just introduce yourself to our audience?
Hi there, everybody. I'm Dr. Ben. So I run a private GP practice in Birmingham. We're now fully video, and we offer a whole range of services to help busy people keep at the top of their game, make sure they're staying well, and avoiding any disease or illness that is preventable. We're now fully video for all of our services. We were providing these services from the city centre of Birmingham until a couple of weeks ago.
A couple of weeks ago, obviously with the COVID-19 outbreak and things like that. So let's address that firstly. So we are fully aware of everybody that's on Facebook. We're fully aware of everybody's aunt, uncle, the guy who stacks the trolleys as that, all suddenly being an expert on COVID-19, medical practices and things like that. Genuinely, while we've got you in the den, can we just ask you your opinion on COVID-19? Can we ask your advice?
Sure.
And really strategically, obviously you're at the end of a phone, you've highlighted that you're now on video call and things like that. So that service is there, but just give us your snapshot of the opinion. And I think what's interesting is if we date stamp this, which is not what we normally do, it is the 2nd of April 2020. So what you're telling us today may obviously differ and change over the next week or two. Okay.
And thank you, Paul. And things have changed over the past couple of weeks quite rapidly. So I think it's important to acknowledge that advice has changed quite a bit. Initially, I actually felt that we should be self-isolating sooner. So I turned the whole clinic into a video consultation clinic and took my kids out of school a week before the government began that shutdown process. And I've always felt that actually social isolation is the most important thing we can do here because we don't know enough about this virus to treat it. We knew that it was very virulent and it's very contagious. And so the only way to stop the spread was to get people indoors in their homes, avoiding contact or travel. So first off, I want to say I'm really pleased that we're all actually isolating because it's what we should have been doing a few weeks before, even though there's a massive impact on business and individual personal lives. It's the only way to slow down that spread. So my opinion is really that we have to be really careful about who we're contacting and also our own personal hygiene. Hand washing is the mainstay. When I go out, I wear a mask and I do put on gloves because although they're not as protective as washing your hands, I put gloves on, I throw them away and then I wash my hands and my face when I've come back in if I've had to go to the shop or a pharmacy.
There's some difference of opinion on the face masks. Yesterday, going backwards, the general advice was that face masks wasn't worth it, were a waste of time. Actually, overnight and to date, unfolding, that the advice seems to be drifting towards face masks are beneficial. What's your opinion on that?
It's interesting. I've always felt that face masks have been undervalued in our culture, but if you look at places like Hong Kong, Singapore, people wear face masks on a regular basis to protect themselves from particulate matter. Now, the question is, how effective are face masks? And it does depend what face mask you're using. So, but to be honest, I would reckon anything that does cover your mouth and nose at a time like this is worth trying. I think there's a lot of confusion between the effectiveness and whether there's any benefit. And I think any benefit, there's a fair bit of evidence suggests that where they do use masks, there's less transmission. So any benefit is definitely worth trying. Whether in the medical context, a face mask will stop you getting COVID-19, there's less confirmed evidence that that is the case because doctors and nurses who are still wearing full kit are still getting it, which just shows to me how virulent it is. So I think if you have a face mask, wear it. This seems to be not an airborne infection now. The WHO have confirmed that it is actually droplet, which means people coughing and sneezing onto you is the main form of infection. You picking it up either on a surface or let's say a piece of paper can stay there for 24 hours. It can stay on a surface for 72 hours on hard surfaces. So you then touch those surfaces, and you might touch your eyes, mouth, nose, and the virus is transmitted that way. So I think masks are still valid, especially for people who have the virus. It stops them transmitting it to other people. So I've always felt masks are beneficial.
You're an advocate of masks.
I am, yeah, and I think I kind of think anything is worth trying in this environment. Anything that will reduce the spread is worth trying, because we're talking about protecting people from dying. There's a high death rate of people who get this in certain categories. We have to protect them. I might be okay because I'm young and fit and healthy, although I have asthma, but it's well controlled. But other people with chronic disease, you know, they aren't going to be so lucky, and we're going to probably all know somebody who's affected in this current crisis.
Well, it started to come up in the press now about people dying. If we'd have said last week, you know, anybody, one that's got it or two that's passed away, the answer would probably be no, but that's going to become more and more prolific as we go through. I think from my point, just to go through the history of this, it was around China that we think it was originated from.
Yeah.
And we now think, if you're looking at research and things like that, it was towards the end of October, November, and not the end of the year. So that's kind of a few months of us. We're looking at about 3 monthly sort of cycles, aren't we, for countries to get hold of it, to get to grips with it, and for numbers to start reducing, which doesn't mean that we're out the woods. It just means that really the measures that are in place in the countries are kind of taking control of this. Now, we haven't got to the peak in the UK, have we?
Not at all.
Can you just elaborate on that?
I'm not an epidemiologist, Paul, but I'll do my best. So, from what I understand, I don't think we've certainly even begun to encounter the peak. I think some of the measures have potentially flattened the curve. Places like London, where there was massive mixing, no restrictions early on, and they had an earlier infection, are beginning to become full up, which is why you're seeing the XL being turned into a 4,000-bed respiratory department. But I think there is this cycle. Italy seems to be getting on top of it now. I think we are. It's hard to say where we are. It's more regional rather than a whole country, because this is actually regional epidemics. Wolverhampton was second outside London to pick up and have quite a spike in cases, and it usually is 1 or 2 people who are super infected who then infect everybody else, and suddenly you get a massive spike in an area, which then overwhelms that hospital in that particular area. So really, I think we haven't seen the half of it. I'm afraid to say I think these restrictions may last longer than just the 3-week lockdown, and it really depends on how people respond and how careful they are as to how long this will go on. I was disappointed when people in London were still socialising things. There's a lot in the press about that. I think people now have got to grips with the social isolation, and I drove to Wakefield I work in prison as a doctor, and I had to go in at a shift at the weekend because they were short. Drove to Wakefield, and the M1, I was the only car for miles.
Back to the 1970s.
Okay, well, I wasn't driving in the 70s, but
okay. Well, let's so if we hold the COVID-19 discussions at this point, just to say that you're a downtown business member, obviously you're open to do general practice, you're contactable online, you know, you're ready there to give advice to anybody. That's good. But let's take it back to talk about you and talk about your practice. Why have you decided to come into private practice? And why? Well, second question is, why did you do that in Birmingham?
Interesting. So I've always done a mixture of private work and NHS work, and I still work for the NHS in prison at the moment. I in about 2012 started doing some work in the financial sector when I was living in Yorkshire with banks and finance houses up there who wanted screening medicals. So I worked with some of the banks, First Direct, and some PwC, for example, helping to offer them access to screening medicals. And then that then morphed into actually setting up a private practice in York with a non-clinical colleague, which was a full practice. Then for personal reasons and family reasons, we moved to Birmingham in 2018. And naturally, private practice is my bread and butter, so I looked for a place where it was going to be suitable, and the city centre being a sort of high density working population I felt was under-resourced with private clinics, and so we chose there. So we have 2 sites, one in the Colmore building for that building, and one in Cornwall buildings just off Newhall Street, which we tend to attract a lot of financial legal type people. So we have a lot of lawyers who we look after, people who are that busy that they haven't got time to get to their NHS GP and struggle to get through that system.
Okay,
yeah.
so what are your USPs compared to your normal GP?
First of all, we try to treat people really as an individual rather than population medicine. So we'll deal with the person in front of us rather than just saying, right, everyone of this age has to have a statin. We'll say, let's look at you and say, what's your risk? What have you done? It means you might have to have a statin or not. So we tend to be very, very personalised, and we offer the time and the relationship to do that. So we talk about that good old-fashioned GP relationship that you might have had in the old days, combined with cutting-edge technology and research to give you the best possible health advice and deliver it to you in a convenient way. So we always have same-day access. We can always fit you in on the day if you call. We run a lower occupancy rate so that we can do that, because we know that if you're a top business person and something happens, you just want to get to see the doctor, get in, we are there for that. We're waiting for you.
Okay, and I think from my personal perspective, obviously I've been to you and I've been treated by you and things like that, and the service is bizarrely good, because it's not what we're used to, because I'm used to phoning my GP between a certain time, getting an appointment in about 3 weeks' time, when pretty much whatever the problem is gone. I contacted you and you'll say, like, yeah, well, I've got a slot in 2 hours' time. Do you want to pop in and see me in 2 hours' time?
Exactly.
I'm sitting there, I'm talking to you, and I'm talking to you a better service and a different lot of mindset towards treating patients than my doctor has. And I think to pick up on your point about certain demographics and age and things like that, my GP has got a mindset of treating me in a certain way. You treat me individually, and you've treated me particularly well. So for me, it's a personal endorsement, but clearly that's not what we're here for.
Glad
today.
to hear it's worth it, yeah.
Just tell us a snapshot of some of the other services that that you offer as well.
Well, we run an integrated health model. So we look at biological, psychological, sociological, spiritual factors. So part of our team, the first thing we did was introduce psychologists. So we have video availability for psychology appointments, because we know that 60-70% of most health conditions is mental health, is psychologically based. So even if you have let's say pain, for example, you're going to have higher levels of pain if your mental health is worse. So if we can deal with the mental, we're going to be better off in all aspects. And we know that stress is the biggest cause of disease. So if we can deal with the mental side, that's really powerful. So the first thing we introduced was a psychologist alongside our GPs. We also have GPs who do minor surgery, facial aesthetics. We specialize in weight management. So that might be sort of avoiding weight gain or promoting weight loss. And we also have a new menopause clinic, because we know that women are working through the menopause in work. There's a really intrusive set of symptoms that can really affect their ability to, well, and there isn't a menopause clinic, as far as we're aware, that's operating in the city centre of Birmingham. So we're offering that convenience as well. We have a nutritionist, because one of the big things we measure on is nutrition. Diet and lifestyle is so important. It underpins everything that our health is going to be made of. We are what we eat and what we do. So it really matters. So we've got a great nutritionist who can help with people all around what they're eating, how they're eating, why they're eating. There's a lot of psychology in that too. So that's just a flavour of these different services that we offer. And every time we come across something that we identify as an issue, we'll try and build a service to meet that. But just to say, we also have a great set of associates who are people who we prefer to refer to, who we've got personal experience of using. So osteopaths, podiatrists, dentists, you name it, those kind of things. We really want to be a source of excellent care, and we'll guide our patients towards wherever they can find that. So if you've got a scan and need to have it in London, we'll book it for you in London. We'll find 3 places if you're in Dublin or wherever. The point is we can get you what you need really conveniently, and hopefully minimum interruption to your day.
Okay, so is the business that you've got, Optimise Health, is that a franchisable model? Are you going to roll this out all across the UK?
Yeah, we're looking to. We chose Birmingham as a test bed. So we spent a year, 2019, really developing our methodology, which is backed up by our own software. And actually it's quite agile. So it could be done anywhere. We're looking to migrate to most of the major cities in the UK over time. There's a small interruption at the moment called COVID-19, but I think after that, there'll be a lot of people.
Yeah, that's a small point. And the other thing, tell us what you're doing for students, because you're looking at the student market. You've understood that Birmingham's got a large demographic of students, and you see that there's specialised and unique sort of issues around students.
Absolutely, and I'm doing some live events streaming for students on mental health every Wednesday at 1 o'clock for BCU. Which really, mental health is a massive issue for students. So what we're trying to do is help these guys to have the best habits they can now, so that when they enter the job market, they'll perform well for their whole career and be happy for the whole of that career. So bearing in mind, they are tomorrow's professionals. We're trying to look after them now, so they, as part of their studies, they develop good habits now. And part of that is this mental health sort of building their own personal kind of foundations for good mental health. So I'm looking forward to those events, yeah.
So treating them with STIs, alcoholism and stress and everything else that students traditionally have, but they don't seem to have these days, apparently.
No.
So that's live streaming on a Wednesday afternoon?
Wednesdays at 1 o'clock. And we're also doing live streaming events every Tuesday and Thursday during the lockdown, about basically things that are going to be useful to our clients. So working from home, what we tend to do is we'll have someone who's an expert, we'll join them, interview them. So on Tuesday, we've got one with a health ergonomist, all about setting up your home office to make sure that you're not going to get back pain, neck pain, and just discussing how you're going to work at home well, how you succeed at working at home.
And how would we find these live streaming? Where are they?
We are going to put them out on our socials. So you could follow us on Facebook. It's Optimise Health Clinic. On LinkedIn, it's me, Dr. Ben Sinclair, or Optimise Health Clinic. We're also on Twitter, on Instagram, Optimise Health Clinic. And we're going to put out a link there, which you can just click on and join the feed. So it's going to be 1 o'clock on Tuesdays, middle of the week, Tuesday, Wednesday, Thursday are these feeds. And
are you leading all of those yourself personally?
I'm leading them, but I'm doing them in conjunction with experts. So we've got our nutritionist doing one. We're doing another one on specifically mental health in business for entrepreneurs and SMEs, or people who are needing to really keep their mental health tip-top in business, not just students. Doing another one on spiritual health. We've got a vicar who's coming on to help us just identify what it is that we can do to bolster our spiritual health at a time like this. And we'll keep bringing in more experts as we go.
Okay, I mean that's excellent service, and obviously that's free of charge, and that's just out there as a gesture of goodwill from you. Absolutely. Which is fabulous. Okay, so what's the future for your business? Who are you going to include in the business? What more services? Where do you? We talked about franchising it. We talked about taking it out there, but what else is on the horizon for you?
On the horizon, what we really love to do is partner with businesses who want to improve the health of their entire staff. So there may be a tiered approach from the top down, whether there's partners in the business who need a particular 24-hour access with me on call, or one of our doctors who's their preferred doctor, down to maybe some middle rungs where people need proper screening medicals, but not just a tick box thing where they get some tests every year and they never read the report. Something that actually makes a difference to their performance. So we're looking to roll that out across the country. And a lot of our clients already have offices in London, Manchester, Birmingham. So we're already dealing with their teams there, and we're hoping to launch a clinic in Manchester this year. Okay,
so let's put this in perspective. If I've got a business, if I'm head of a law firm and I've got 50 lawyers working for me, pretty stressful job, pretty awkward, unsociable hours. Just pre-screening, screening, and looking at the outcomes for that. Is that going to add financial benefit to my company? Is it going to improve performance and so on? Sorry, go on.
That's fine. No, so we're all into performance. So what we find is that once someone has an appointment or a medical with us, that rapidly they identify what the key areas for them to improve their performance are. They're generally happier. Once they put these in place, they generally lose some weight and they generally reduce their risk of disease, and that means they're reducing their risk of absence from work. So immediately there's going to be a knock-on benefit of absence. There's also a knock-on presenteeism, which is bad for the rest of the team. So we generally help people to get the boundaries right as well. So if you're a top lawyer and you want to optimize your team, we use a kind of a health coaching model to help everybody basically be their best they can be, but from a health perspective, which is integrated. So it's not just what you're eating or what you're taking medicine wise, it's how are you boundarying your time, what are you doing about stress, and what are you really suffering from? Because a lot of people are carrying mental health problems or addictions that are sort of low level. Some of these things are really picked up recently because they're being isolated and they're flaring up because they haven't got their usual coping strategy, which is work.
Okay, so I'm a classic example of that because obviously, I tear around. I've got probably 6 or 8 different jobs involved in many different companies, and I can't sit still. If I go on holiday for 2 weeks, guaranteed, towards the end of the first week, I'll start feeling unwell. And in the second week, I will definitely be unwell. Yeah. So I imagine there's a lot of people out there with a similar sort of mindset and lifestyle to me. What Absolutely. Would be your immediate few tips now, just to guide me and guide everybody else?
Yeah, a few tips now. I think this applies to people on furlough as well, by the way. So I think, if we're talking about extended periods away from work, the key thing is to maintain a routine, whether it's got some element of cerebral stimulation or physical exercise. It's important to maintain a routine and to avoid excesses on holiday, because the danger is we think everything's on holiday. I can take a week off from everything, but in the evidence, a week off, i.e., if you binge on everything for a week, it actually has a detrimental effect on you for months afterwards. So it's really worth maintaining yourself, but also being kind to yourself on holiday. So not expecting too much from yourself, mentally or physically. And I would build into that holiday some therapeutic activity, whether it's a holiday or just a furlough. So I'm encouraging a lot of people to take up a new hobby, or maybe start building something or making something they've always wanted to do. And I often do that with time off. So I'm actually making a new tree house for my kids at the moment, because I've been meaning to do that ever since I moved to Birmingham, and I've never quite got there. So I think if you've got an idea like that, something creative, an outlet for that, that can be really helpful to give you some purposeful activity, alongside, of course, leisure and enjoying time with friends and family. That's really important too. But it may be that if you're physically struggling to do that kind of thing, you might find solace in something like as simple as maybe knitting, or something sedentary if you can't be that active. And even journaling itself, the process of writing stuff down has massive benefits of clearing your head, especially with an emphasis on gratitude. So if you're looking to survive at either a week off on holiday and you're one of those driven people, journaling can be really helpful. I'd say, slotted into a routine. And these are all the kind of things we'd create a life plan for someone for mitigating a risk. And the risk is that your health deteriorates in a time when you've lost that structure of work around you.
So I think the advice that I'm taking away from today is, one, don't enjoy myself too much on holiday and focus on some productive things. But secondly, if you're on furlough or you've got other time to spare, start writing a book. Potentially everybody's got a book in them.
Absolutely.
Might be an ideal time. Okay,
Absolutely.
So I'm looking at the time now, and we've took up about half an hour of your time. Yeah. Just for the last few minutes, is there any last key messages you've got for Downtown Business members or the general public, sort of wider from that?
I have. Well, I think we're in a time of reset. I think the whole world is having a big reset, and I think it's a great time to reevaluate your priorities, sit down, look at your life, decide where you want to really spend your time, decide where you want to spend your energy, who's good for you, who's not. People who you've been in contact with during this lockdown time are probably the people who are most important to you. So it might be worth investing in those relationships. I think a lot of people have got out and started walking or doing more activity during this time. I would say use this time as a template to try and build a structure for yourself, so that when work kicks off again, you have those healthy things back in there again from this time. And if you do identify something in this time that is a mental challenge that's risen or reared its ugly head, deal with that at source by getting some help from a psychologist or from someone who's a mental health expert, because it's not going to go away. It's part of you, but learning to overcome that and live with it is probably the most important thing you can do to enjoy life and be successful in the future.
Excellent, clear advice. Dr. Ben Sinclair of Optimise Health Clinic, based in Birmingham. I want to thank you for your time, for coming to the Downtown in Business Den. I've been Paul Cadman, your chairman. I'm still Paul Cadman, the chairman of Downtown in Business. Thank you very much, Ben. Have a fantastic day.
Thanks, Paul.
Cheers.
For now.